Hello, I'm Dr. Roger Hicks. I'm on the board of directors of the California Urgent Care Association. I have a urgent care clinic in Grass Valley called Uvadox Urgent Care, and thank you for joining us today for our session on the health effects of climate change. Climate change is a huge public health threat to America, the world, and future and present generations, really. That's why we're talking about this today. Most Americans think that climate change is real, but most think it won't affect them personally, and they can't name a specific type of health threat or disproportionately affected group. We as healthcare professionals are still a trusted source of information these days when information comes from so many different places. And so therefore we have a bully pulpit that we can use for good. At the same time, climate change is frequently a political issue. And we are going to try and keep politics out of the conversation today and have a productive discussion. We need to understand the way climate change impacts health so that we can speak with authority to our patients, our friends and family and colleagues, and local leaders on climate and health, on the climate and health connection. I am really happy today that we have two experts in this field. We have Dr. Catherine Sundquist Forrest, who is currently the California Medical Director for the Curative Medical Associates Vaccine Project and the Health Equity Contact with CDPH here in California. She teaches family medicine at UCSF's Natividad Family Medical Residency Program and has an MPH in Environmental and Occupational Health from UC Berkeley. Dr. Maya Heinert graduated from UC Santa Barbara, did her medical training at Wayne State, earned an MBA at Sac State, and is board certified in general pediatrics and pediatric emergency medicine. She is now working for the Alliance for Health in population health for underserved communities in Santa Cruz, Monterey, and Merced counties. So I would like them to just introduce themselves in terms of how they became involved in this issue of the health effects of climate change. Dr. Forrest.
Well, thank you so much for inviting me to come. It's an honor and a privilege. And one of my last clinical jobs immediately before coming to the residency was actually in Stanford's urgent care system. So I appreciate the unique opportunity for the exacerbations that are directly climate related to have crucial conversations with our patients. And we'll talk a little bit about that why later. I originally became interested in the interactions between environment and health in my master's program at UC Berkeley in environmental and occupational health. And it was started out as a relationship between toxicology and human health and workplaces. But as time has gone on and we're starting to see some of the climate change, it's changed to some of the direct impacts of climate. So extreme heat and wildfires and other things that have to do with land and water and air quality directly impacting health. And so I've been called on an expert in the field to comment on that. Was I trained to do this, to speak out, to speak to media, to speak to other physicians? Not so much. But as I have learned in my workplace, as Dr. Hicks mentioned, we are trusted individuals because of our training in critical thinking and communicating risk, that there is a role for us in doing that exact thing. So increasingly, I have found myself using those critical faculties to learn more about what's new in the world with regard to climate change of the last 10 years. And then how can I use that information to be able to communicate that to both to our patients, but also to populations, to communities. And that's how I'm hoping to engage you all in how can you also be involved both individually with patients in your direct patient relationships, but also in your community.
Great, thank you. And Dr. Heiner, could you say a few words about how you got involved in this topic or your interest in this?
Thank you, Dr. Hicks, and thank you, Dr. Forrest. So my journey is a different one, and I was a pediatric emergency medicine provider for almost nearly 20 years, and so learned medicine and learned the business of medicine. And at a certain point in my life, I think it was actually after I had my children, I started looking at the world more critically, and things in that time that were happening in the world I didn't understand. And some of those things were the housing crisis and the financial crisis, things like that that affected large numbers of people. But I saw people that were about my own age, maybe, that would seem to be running the banking system and running the financial system and housing systems, and yet these systems crash. And I had a desire to understand more. My journey took me to an MBA. I decided to try to understand more the business side of healthcare. I thought that where the money flowed is how decisions were made. And sadly, that is still, I still find that to be true. But along that route, I changed over from my decision to provide care one-on-one with patients to trying to throw my hand into the ring to how my voice could help change larger issues. And with my own growing family and my own growing knowledge about how decisions were made in the world, the issue about climate change and how this is affecting human health became of more and more significance to me. I talked to Dr. Forrest yesterday. I consider her an expert, and I said, I'm an expert. I work in population health now for the Alliance, the Central California Alliance for Health, that serves coastal communities and agricultural communities in the state of California, all Medi-Cal, so all underserved. So my comments today will largely be from that aspect when I look at population health and how even in the last 3 years, populations in California have been directly impacted by climate change. I think that the future will depend on conversations like this. So I'm so happy to be here. And I welcome all of you for being here today. Thank you for making your lunch break to be with us today.
Thank you. Thank you, Dr. Heiner. So let's dive into it. What are the main climate phenomena that impact our health?
Well, if I can start, I will share a slide, and then I'm going to let Dr. Forrest launch into that. So one moment, please. Okay, is it viewable to everybody?
Yes.
All right. This is actually just, this is a quote: "As the only sector with healing as its mission, healthcare is an opportunity to use its ethical, economic, and political influence to be a leader in climate solutions." And that reflected what Dr. Forrest said. All of us here have a voice, and maybe it took me years, maybe a decade after, to understand how I could use my voice. This next slide won't change to it.
Maybe.
Oh, there. Okay, it's a moving slide. I had to hit a couple of times. Everybody see that?
Yes. Whoops. Yeah.
Oh,
Go back one. There we go.
There we go. Okay. And so I'm going to turn it over to Dr. Forrest, but the audience can just kind of see, looking at this slide. This slide illustrates the most significant climate change impacts that you can see here in this beautiful wheel. And you can see how everything is interconnected.
Thank you, Dr. Heinert. I would really want to take a second just to look at this wheel, because it's really an important slide. And I think as critical thinkers in medicine, we're taught to think about how the intersecting parts of the biological systems in a body, one affects the other. And really, the human organism is a great way to look at the global organism of ecosystems, and why the human activities, particularly the burning of fossil fuels, might have had this broad impact on the globe and hence on global health. We think now that the number one intervention on the health of humans has to do with this fundamental shift in the system that had to do with the burning of fossil fuels, releasing sufficient quantities of carbon dioxide and other greenhouse gases to trap heat in the lower atmosphere and affect global climate. It is really irrefutable. I am not a climate scientist, although believe me, I love to deep dive into it to see if I can understand it. I can't help it, but I'm not going to talk about it because it's not my area of expertise. However, the globe is warming. It's indisputable. There's vast consensus on that. And in each of the last decades have been successively warmer than the previous one since the mid 1800s. Sea levels are rising, glaciers are melting, precipitation patterns are changing, and extreme weather events are becoming more intense and frequent. And that is being understood as the #1 factor in the shifting of healthcare across the globe, not just in this sector of the globe, but across the globe. So there might be some localized benefits like fewer winter deaths in some parts of the world and better production of food in the others, but the overall health effect of the changing climate is not great for our planet. And there's a 10-year, give or take, window of action where we might be able to make some difference there. And in the meantime, it is upon the one trusted voice, our healthcare professionals, to try and make a difference. So we're going to talk just a little bit about what are these changes and what is the effect on health. So I'm going to just kind of go through them briefly. Extreme heat is one of them. And across California, of course, we've seen this. I ran the vaccines across the state of California this year, and I had to close our outdoor sites so many times this year because of heat that has never been actually registered for ongoing days. And of course, the heat dome across the northern part of the country this year was unprecedented. In the heat wave of 2003, there were 70,000 excess deaths from heat. High temperatures raise ozone. Of course, those of you in Los Angeles, in the Central Valley and in some of the areas where ozone is exacerbated because of conversion know something about that. And of course, pollens and other aero allergens also go up in extreme heat. They can also trigger asthma, which affects, I think 200 or 300 million people. Also natural disasters and variable rainfall patterns. So we're looking at the tripling since the 1960s of extreme weather that has to do with rainfall. So by this, we're talking about the patterns of intense weather patterns that also affect fresh water. So there's impact on lack of safe water as well, which contributes to compromise of hygiene and diarrheal disease, et cetera. And also in extreme cases can go the other direction, drought and famine as well. So these are the other things having to do with extreme weather. Flash floods is another one, mudslides, et cetera. And then that can also affect staple foods. Patterns of infection, being able to look at the transmission of disease through insects or other cold-blooded, animals or vector-borne diseases. Malaria is dramatically affected as well, et cetera. So these are the kinds of things that we're already seeing as a result. And as a consequence, also mental health. COVID is actually considered to be climate related because of the encroachment in populations as a possibility, but in areas where there has been massive changes due to extreme weather, we know that there's increased anxiety and depression. And those of you in California, we certainly know the impact of wildfires and the anxiety around wildfires is in itself a trauma and affecting mental health, and can also cause disruption in the healthcare systems. I trained in Santa Rosa family residency program, and my residency program was completely disrupted by the Santa Rosa fires. Took a huge toll on that community. So I just wanted to do a brief, boy, was that a flash little overview of the health effects, but they're tremendous health effects. The World Health Organization issued a report a few years ago saying between 2030 and 2050, climate change is expected to cause an additional 250,000 additional deaths a year just from malnutrition, malaria, diarrhea, and heat stress. That's
So,
just phenomenal.
okay, thank you. Can you put that slide back up, Dr. Heiner, one more time? I think in summary, what I heard you say and what this slide illustrates, the four main things about climate that affect health are increasing CO2 levels, rising temperatures, more extreme weather, whether that be, hurricanes or drought or, loss of snowpack in the Sierra. And also, one thing that wasn't mentioned is rising sea levels.
Rising sea levels, correct.
Yeah.
Mhm.
Which affect some parts of this country, like everybody saw the slide or the news of the subways flooding in New York, for example.
And most of Florida, yeah.
Yes, and most of Florida, and then there's low-lying, island countries that are going underwater. Great, thank you. Dr. Heinert.
Well, I'd like to just follow up with what Dr. Forrest mentioned. And I think I want to bring it to the level of our audience now, that you as healthcare providers are experts of your own population. And sometimes you may be seeing or recognizing patterns, different patterns of whether it be infections or asthma related or respiratory related problems, heat related problems. So what you're seeing is a symptom, and it's a one flag to you of a bigger picture out there. And so what I wanted to bring to your attention is that there are resources for you to understand this in a population-wide perspective. What you're seeing is real, and even if you haven't put the pieces together yet, we are seeing this especially when we look at the populations of California. The risks are unevenly distributed. So the effects of climate change have exacerbated the inequities that already exist among our populations in this state. I'm going to concentrate on this state for now because I'm assuming that's where all of our audience is from. But so when you look at your population, there's different resources that you can look at that can help you identify, even down to zip code and census tract, and many of you are familiar with those. So health risks, such as underlying disease, there's social vulnerability. So things like number of cars in the household, who has a job, how many parents are in the household. The Healthy Places Index can give you additional information. That's a wonderful resource from the CDC, through the state of California, rather, that can help to identify more at risk. It can help you really hone down at at-risk populations in California. So looking at location and social vulnerability, there's other things in your practice that can help tease these things out, such as age of your patients, their language and cultural barriers. So the linguistic barriers are real. And we've found that even people that are comfortable and most comfortable speaking, for example, Spanish at home, often will tell healthcare providers or on surveys to speak in English, even though they prefer to speak in a different language. Mental health issues, ACEs, as you're all familiar with ACEs, all of these things and more can help you to identify.
Can you say what that acronym means, please?
Yes, adverse childhood experiences. And for those of you actually that may not be working with pediatric populations, this is a big initiative in the state of California with our Surgeon General, Dr. Nadine Harris, to push forth screening and treatment of adverse childhood experiences, which are things like from things like having only one parent in the absence of one parent due to death or even divorce, to more pervasive or larger issues, such as displacement from a homing situation or child abuse or neglect. And so there's a lot of resources in the state of California for those, for ACEs screening and for treatment.
Okay.
This is the thing what I'm really appreciating and I think is really helpful here is to realize that, again, as Dr. Heinert said, there's an opportunity to use sort of words that work with when we're seeing patients in these situations. There is an unequal impact, even though climate health affects everyone, there's a disparate impact across populations. And when we're seeing our individual patients, there's ways in which we can help people see in ways in which climate is related and activate to help them take steps to protect themselves and their families. So for instance, if you're seeing somebody that they're having an asthma exacerbation and that you know that it's related to, say, smoke from the climate fires, you can use the word climate fires, and you can talk about how they could use their controller medications as using the things like the air quality index to help them. Well, that's not part of what we were trained to do, but it's something that we can start doing as we get educated ourselves, right? So that's something that each of us can learn something about, because it's a shift and a change since perhaps we were trained, but you can learn a little bit about that and then start doing something about that. And we can also try and use our voices to address climate change. So for instance, the Medical Society Consortium on Climate and Health recently has been much more formed to be more active, to say with the voices of physicians and also allied health professionals, physicians assistants, nurse practitioners, et cetera, to say that these health professionals are trying to strengthen with the clinicians for climate action for policies to protect the environment. And so, for instance, I don't know if the particular organizations, it sort of depends a lot. There's a lot of specialties in urgent care, but for instance, my organization, the American Academy of Family Physicians, is part of that. So is the American College of Emergency Physicians, and so is the American Academy of Pediatrics. So it has, I think there's 45 organizations that are a part of it. And if you are interested, I'll make sure that Dr. Hicks and your organization has the link. You could be a part of that action group, and then add your signature and your voice along with the, the 600,000 physicians that are a part of it now, to try and have stronger policies to help protect against climate change in this window that we currently have, to try and help protect our patients from climate change impacts.
So let's talk about some of the main areas, specific things where climate change affects health. Like, how about air quality? We've had a lot of record wildfires here in California that have affected us not only locally, but even on the East Coast.
Mm-hmm.
The air quality index here where I live was up to 450 at some points in August. So can you talk about, how air quality, the different ways air quality affects health?
Sure. One thing is to recognize that air quality from fires is complicated because it's both particulate and toxins, but the main problem is particulate. And so as the air quality changes, we really wanted to have our patients that are affected by particulate air pollution to be in situations where they're not breathing that in. So they're inside, they have HEPA filters. They are, when they do go outside, they are protected with respirators. They're not increasing their exercise, and they are people with both restrictive and obstructive and lung disease, or with cardiovascular disease. So it's not a lot different than what you might do in other high particulate environments, like high pollen count, for instance. So if you think in terms of what did you learn about other high particulate, you would make that same recommendation to patients who are at risk for those environments. Then there's the question of how do you use your voice? One thing that you can do is directly to your patients. So in Los Angeles, for instance, one of the things that we opted to do as part of the California Healthcare Foundation Leadership Project was when the air quality went above a certain area, we chose to go onto the news. We did this in the Bay Area as well, to go onto the news and say, with the wildfires, with a warning to stay inside, and why, that this was a climate fire and why. And we were very directive with what kinds of lung diseases and cardiovascular diseases were we talking about here.
Mhm. Well, while we're on the subject of wildfires, they affect more than the air quality, of course, in terms of our healthcare system. There's destruction of infrastructure, like hospital burning, or part of the hospital burning in Paradise, for example, and then mass evacuations, where people leave their homes, they go to shelters in some cases, have to bring their medications with them, or if they have some electrical, CPAP or other, appliance. And then, of course, in the shelters, there's been norovirus. The wildfires cause degradation of the watershed, which means mudslides, decreased water quality, and even water supply. And then there's been studies on the number of ER visits as related to wildfires, and they definitely go up.
Mhm.
Yeah.
And I'd like to just add on to what you said, Dr. Hicks, because working with Medi-Cal populations and having thousands of people evacuated, and people even in areas that were near evacuation areas that felt that they may be at risk, who left. You're right that it's the healthcare issues related to respiratory problems, but also not to be insignificant at all, the anxiety and fear and loss and grief that these people experience, sometimes leaving pets behind or losing belongings, in addition to underlying health conditions they may have that can suffer because they don't have their equipment. We saw many people that it took sometimes time for them to get their prescriptions filled at a brand new pharmacy somewhere else, and other equipment that they may have. So, and including things like their mobility devices.
Right.
Sometimes people leave with things, but sometimes they leave them behind.
I mean, we know we should all have our fire go bag and an evacuation plan all set. But the reality is that doesn't always happen. Our community, we're probably an hour and a half from Paradise, but we saw a lot of people here, refugees from Paradise who didn't, their doctor's offices were closed. They had no physician, no medications, as you said.
Yeah. It is a reminder, I think, for the physician community to localize the issue.
Mhm.
So if you're in an area that is at fire risk, the vulnerable populations are going to differ based on what is the chances that someone is what are the problems going to be with evacuation, how isolated, what are the age, who are the vulnerable people in where you are, and then what is the messaging to them, because we know that the most vulnerable people the climate change exacerbates existing differences between populations. It doesn't start it, but just exacerbates existing differences to access to healthcare and population outcomes. So just as we saw in the pandemic, this a worsening of the health justice divide, climate is doing the same thing, and it will continue to do the same thing. And our voice can be used to assist in that and to advocate and prepare people. So for instance, around the thing having to do with power, we can advocate for subsidies for power independence, or for access to, like what we did in Santa Rosa, was ways for people to get to register their medications more centrally. So when they lost their medications, we could fill them quickly. So there are ways in which to localize this that I am so impressed every time I go out into a community, how well a physician community knows its area. There's no one who knows your area better than you. So being able to communicate and put together programs to help protect our most vulnerable. And you still can't prepare for everything, obviously, because health is complicated, including things like you're talking about, pets that are a part of the support system. You can't replace a pet in the same way. Or for mobility, how do you get access to mobility when the place that somebody is transported to itself is not accessible, right? There's some complexity there that has to be you're just troubleshooting. One of the things that was put together after the wildfires 3 years ago was portable systems that did not rely on the internet, because the internet went down. So everyone has gotten so used to having communication. Well, when communication systems take a dive, what are our workarounds for that? And these are things that have to do with, I think, understanding that this is real and with us, and what do we need to do to be able to work locally and nimbly when the impact happens, and also strategically forward, how do we mitigate it so that we can stop its acceleration? Those are the policy issues that we're talking. What are our voices together and with other like-minded people in healthcare and just around global climate change?
Right. What about?
And how do we engage our patients to see it?
Yeah.
Sorry.
Do you think that most people make a connection between climate change and health?
You know, I think that some people do. And one of the things that still is just sort of humbling and a miracle is that when you have a relationship as a healthcare provider or physician with your patient, and you make the connection, other people are more likely to make the connection. So I think we have a huge responsibility right now. It has been demonstrated that the number one health intervention for the globe is actually slowing down climate change.
Right.
So every time a physician turns one mind around, it's more important than obesity. It's more important than just about anything. It's the thing that we could do to impact health more than anything else. So every time that someone successfully makes the link in our society, in our communities, with our patients, it's one more person. So do I think that people, that's too broad, but I do think that we have, and then, you know, it's an incredibly powerful tool, is the trust that's placed in us. So my experience says, it's why I keep trying. I don't know if it works, but I'm hoping each person that's listening has had the experience where they tried to say something about something that they know deeply and scientifically about the world, and someone changed their mind, or at least thought about it. And so changing the world one patient at a time, or family member, or community. So that was a long-winded answer. I sure hope so, Dr. Hicks.
Well, I would say that I agree that the biggest, I don't know the answer to it either. I know there's a lot of, people learn on social media now. It's amazing how people get their information out there. But I do believe that we have an opportunity, like Dr. Forrest said, one doctor at a time. It's a trusted voice, and it may start in the office with just speaking to the staff and making staff aware of the problem and your deeper understanding of it. And it may be signage in the office that can be from trusted sources while people are waiting for them to read things that may pique their curiosity and maybe even speak to you about it, the correlation between their health condition and the climate.
I do know that when the medical consortium put out its statement last month, that it got massive coverage across the nation. I mean, on some of the biggest platforms around. It was an unprecedented effort for the medic to educate the public, and it got the attention of some of the big folks. So can we do it one-on-one? Yes, but we can also do it together. We got coverage with CBS, USA Today, Business Times, NBC, A lot of small papers, Medscape covered it. A lot of our medical news covered it, including the AMA covered it, Scientific American. I mean, people take notice when physicians take a stand on anything. And we're doing it together. And I think if people do it individually, it will also matter. NPR. Anyway, that's my belief, is that our voices together also matter, and our voices, trusted voices individually, matter in our communities.
Right. Okay, well, the wheel there has various, specific things, some of which we've mentioned, like the heat-related illnesses, the air quality, water, the impacts on water quality and water supply, of course, during hurricanes or droughts, water supply quality and just the amount is affected. But what about the vector-borne illnesses? How is that related?
I can speak to that. I don't, Dr. Heiner, you might have something to say about this too, because you have a sort of a broad view of population. But especially at Stanford, we started to have to look at in areas that we never ever had to look at in California for vector-borne disease. And it's because of areas of flooding and migration of people that brought some of the diseases to places that didn't used to have them. So you name it, you're seeing it. So unprecedented numbers of cases of West Nile disease and of dengue fever. We had some of our first cases of malaria that were endemic in places across the globe that hadn't had it before. So vector-borne disease has to do partly with migration of people, which can also happen because of climate. Climate migration is a real thing. People leaving areas of drought and or flooding, but it also can happen because of changes in a habitat because of flooding and increases in, for instance, mosquitoes borne disease or other vectors where there's pestilence. And crowding. So that is another area. I mean, you mentioned one that's a virus. Norovirus happens where there's crowding and lack of access to sanitation. That's not a vector-borne disease, but is an example of a crowding-borne disease. So that's the kind of thing that we're starting to see that's different. All kinds of tropical diseases where there wasn't tropics is one example. Largely because of flooding and stagnant water where there didn't used to be.
Mm-hmm. I would say that anything that involves water in the state of California is of critical interest. This is a state that we use a lot of water, we need a lot of water, and when water is affected by climate change, including increasing vector-borne disease, that's a big thing. I could offer that resources for you wherever you may be in the state could be your local health department and also your local branch of CMS, because typically there's a environmental and public health committee that reviews this on a monthly basis. Where is there an uptick of, say, West Nile or anything like that? So kind of being on the receiving end of missives from those sources could really help you understand what you might be seeing locally.
That's a great point.
And I think some of the increase is also due to the increase in, or the change in habitat for the vectors. Right? We used to get snow here where I live, lots of snow, and with the warming temperatures, we don't have those freezes, so that increases habitat for some mosquitoes. And I think similar things are happening to other vectors. Other
excellent point
elsewhere.
Yeah, I know that's been a factor for Lyme just because of the movement of herds of deer just from the fires.
Mm-hmm. Right. And then allergies are affected by climate change. Can one of you speak to that?
I'm not an expert in that field, but I do know. So I don't know that I have a great answer than that, other than allergen. The levels of pollens has gone up tremendously just from migration of different kinds of things. And because of the literally the allergy, the pollen counts, but also the distribution and number of pollens. But I don't think I have a lot to offer there in terms of specifics. The combination of pollens plus air quality and inversion has tremendously increased the increased asthma exacerbation. I know that that's another particular problem in parts of our state. You guys are probably all aware of the increase of asthma in the Central Valley, which is thought to be a combination of truck traffic and allergies, including it's actually a complicated a combination of house allergies, crowding, ambient allergens from pollens, and also particulates from air pollution. But maybe Dr. Heinert has more to say specifically about that. I don't want to speak outside of my expertise.
Well, I have not looked at actual rates of but now I'm going to, Dr. Hicks, based on your question, because I think it's a great, I mean, I can make, and probably every physician in the room here could make a assessment of what they're seeing. I feel like there is no longer an allergy season. It seems to be year round, and it seems to be increasing the number of people, but that's just anecdotal. So I think it would be an interesting avenue, and I wonder what our providers if might be people in the audience at the Q&A that might have some feedback about that question.
If anybody does have a question, please put it in the chat. And let's see. So we've talked about a couple of different ways to address this, or sort of broad categories. One is what people call mitigation, which is prevention, basically things to reduce climate change. And then the treatment part, or adaptation, people call that, which are things to reduce the vulnerability that we all have to climate change. Dr. Forrest just put up the link to the Medical Societies for Climate Health. Thank you very much. That's in the chat. So, and you both have mentioned that the climate change exacerbates the inequities that exist in our healthcare system already. So, do you want to talk about, give some more specifics about that, like people of color or urban versus rural, or how the differences in manifest?
Well, go ahead. Would you like to start, Dr. Forrest?
No, I think you've got a good handle on that. Go for it.
Well, I'll just give a sort of a broad statement. COVID has absolutely brought into light to everyone's eyes the disparity in health equity, the disparity in health access, rather. We see this, yes, based on population. Some of the things that I mentioned earlier, like we drilled down. When with COVID, the first thing was looking at people that had underlying health conditions, but we realized it was much more than that. It was based on maybe where they lived, what language they spoke or didn't speak, what their occupation was, if they were frontline or not, and other things like that put them already at risk. People that are working frontline, whether it's in the fields of California or in food services, are not available during business hours to come in for a vaccine. So what we kind of see what COVID brought to light, and when we started distributing the vaccine, it really mirrors the people that are at risk for climate change impacted illness on their health. These are people that don't have access as easily as everybody else for a variety of different reasons. And I will also add one thing, I kind of mentioned it before, that sometimes populations that are isolated can have a narrative that goes around in that population and that becomes sort of accepted fact. And the only way that we know to interrupt that is to put a trusted voice. And as Dr. Forrest had mentioned, we have seen in our work in populations that the physician, as much as there's some bad mouthing of healthcare out there, that a physician's voice still has weight, and other people in healthcare, leaders in healthcare. There's also other voices that should be considered, like, clergy, people working in education sometimes, but really people that work in healthcare are committed, if you throw out a couple maybe bad apples, but most people that are in healthcare are here for a reason. They want to help people maintain their health or achieve better health. So it is a trusted voice, and that's what we've really seen in our populations.
I absolutely agree with that. And I think one of the things that's a challenge as a physician and other healthcare professional is that we're trained mostly to speak in a one-on-one setting or within our organizations, and that the concept of how do you move out into the public isn't necessarily clear to us. And while we've had some experience now in COVID, it's a mixed experience, as Dr. Heinert said, it's kind of a mixed experience about how do you do that and what happens when we do. Is it, as in stay in your lane kind of a thing happened with in some places where we've spoken up. One thing that I have experienced, and I'm encouraging you all to just take a hard look at this, is there are some ways in which we can make individual impact, and then there's intermediate impact, and then there's huge impact. And the global health around climate is huge, and it's directly impactful. And if we can help people make the connection between what's happening in the world around us and this larger issue, we can probably have the biggest impact on our health, our family's health, and our community's health, in addition to our patient health. So it warrants just a look to see whether or not we can take that slightly uncomfortable next step of how to articulate this stuff. And some things are simpler than others. Like in California, even just to go from saying wildfire to climate fire, and understand, if you need to do the dive to understand why that is, why is it that we would call it that, do that learning, but for yourself. But even just changing language, it's part of what we do in medicine, is to understand when it's time to change language. Why we might look at raising sea levels as an important thing. For instance, near me in Moss Landing, they no longer have a city plan that is out past 25 years because they've understood that they can't in good conscience permit buildings that 25 years out. Think about that for a minute. What's our responsibility as physicians then if a city council and planning department can't permit a building out 25 years? What's our health commitment to our patients 25 years out? It's going to look something like what we're talking about right now in our professional organizations or in media. So if somebody calls you and asks, what should I do with this air quality position? What should I do? You can help make those links. So that's what I wanted to suggest. I'm going to put another thing in the link here, which is how can you get more information. Last month, the Health and Human, HHS formed a new office of climate change and health equity, and you can get their newsletter, and then you can learn some stuff. We know how to learn stuff. This is how you're going to learn a few things for yourself. So this is a way to get more knowledgeable about climate change. And then if some question comes up that you don't know, which is most of the time for me, I can go look for information. So those are two sites. I gave you two sites that you could go educate yourself. The first one that I did was the medical societies, and that looks like everything that we always look at. It's very medically oriented. The next one is a little bit more public health, environmental health oriented, but I'm hoping that that's useful to you.
So we have a question from the chat, which is what kind of climate related health problems would we see in an urgent care clinic? So
Sorry.
I have some insight on that as I
Go for it.
yeah. So one thing is with the air quality and living in the climate fire district in the foothills of the Sierra, we see respiratory related problems, asthma exacerbations, COPD. We've also seen increased allergies, and as I said, displaced people who come in because their medications are back home and they were evacuated, or they don't have their glucometer and that got left out of the fire go bag. They need refills on their prescriptions because their doctor's offices are closed or evacuated. Those are the kind of problems that we've seen here. I know that our colleagues on the coast, like in New Orleans, see different problems, hurricane-related problems, where there's disruption of infrastructure on a different scale, on a different method or manner, I mean, than what we have here, where our infrastructure is also disrupted by forest fires. As you mentioned, Dr. Forrest, communication was a huge problem during many of these forest fires because not only is the internet down, but cell towers are down.
Those are great examples. I sometimes, if you look at if Dr. Heinert's in that initial one, any one of those ones, you could draw the link when you see the problem. So for instance, we saw heat stress in the Central Valley, and we drew the link when people that came in or reported that they'd had heat exhaustion or heat stress. We drew the link and said, this, we're seeing more of this, and we think it's related to, we believe that this is related to climate change. Sometimes words that work. We might say to them, this is really hard. Here's what you do for heat stress. Take good care of yourself. We're seeing more of this. So watch out for this in your family too. We're trying to take steps as a medical community to slow this climate change down. So those are kinds of things that I might say. When we saw Lyme disease, for instance, which we're starting to see in expanded territories in Northern California, where I worked when I was at Stanford, we saw it in the Santa Cruz Mountains. We would say things like we're seeing more Lyme disease than we used to. I'm sure you're aware that there are some changes having to do with infectious disease that have to do with changes, climate change. I'm so glad we caught this early. We're hoping to get a handle on climate change to slow some of this down. So hopeful language, but drawing the link is what I want to say here. Every time I got interviewed around the fires, and I was in the paper a lot around it, I would try and make that link saying, it's part of all of our work to try and slow down these climate fires. Here's what you do to protect your health now. Here's what you need to do when you're seeing this, the coughing start with your kids. Start your controller medication when the air quality hits this amount. Stay inside, use your filters. So those are the kinds of things that I see as literally anything on that wheel is what you might see. Is it exactly that time related? I don't know, people. Is it? But as a trend, the answer is, yeah, it is. The data is pretty irrefutable.
So we are getting toward the end of our hour, and this can seem like an overwhelming topic. I mean, climate change is a global thing, but so let's talk about what we can do as physicians. We have touched on this during the hour, but for me, I think of it as think globally and act locally is one place to start. Get involved in your local community, talk to friends, family, colleagues, and patients about these issues is one thing that we can do. Our home energy consumption and our personal transportation also affect climate change. And probably most important, in my opinion, is to work to get climate-focused leaders at every level of government, and then hold their feet to the fire. And that means work to get them elected and vote. And I don't, please feel free to jump in here, Catherine or Maya, please, if you have things to add.
I'll just give my 30-second finale, which is that I can completely support what you said. And I think the biggest thing is the personal decision to become informed and then to start to take steps. There's plenty of ways to get involved, but the first step is that personal decision. The science is indisputable now, but each of us have a decision to make. Are we going to help do something about it, or just wait for others to do something about it? And I think what Dr. Forrest and I came here today was to help demonstrate the ways that every single person can become an expert and get involved.
I really appreciate that. And I think in my own career, you know, I've been in practice for 40 years, and I think to myself, how long did it take us to feel comfortable to say that housing was actually a health issue, that access to health, so what we now call social determinants of health, was something that even in urgent care, I think everybody has a good idea that if you send someone out and they don't have access to what they need to do wound care, that impacts how the wound's going to heal. Like, we kind of get social determinants of health. Well, right now it's global determinants of health. It's a climate determinant of health. So these kinds of things that we're seeing, their cause is kind of big and feels abstract, but it's real. And the things that we do aren't directly in our offices, they're collective action. And our words are what's going to help mobilize the changes. It's not like you're going to go do something direct for a person or direct in any way. It's using our critical thinking, our ability to understand science, the way in which we are trusted to communicate risk, to take us to be able to start to have that conversation so that the things can go into place in this small window that we have to actually make a difference, or things are going to get, the health of our communities is going to be impacted. And in California here, we really know what that means. So I'm very impressed that this organization is taking a stand, because it's not like one of the places where longitudinal health is managed necessarily, even though I know you guys do one hell of a lot of that, and I have been involved in that. But how amazing, it gives me great hope that this group is having the conversation. This is phenomenal. Good job.
Well, thank you so much. And thank you both, Dr. Catherine Forrest, Dr. Maya Heinert, for joining us today and lending your expertise. Our next California Urgent Care Association virtual town hall will be on November 11th, featuring Dr. Patrick O'Malley, who will give us an update on laceration repairs. So thank you all for joining, and we can save the world one backyard at a time. So think globally and act locally. Get involved. Thanks, everybody.
Thank you.
Thank you.